Platelets are responsible for the clotting process. Hemostasis is the process by which blood clots and inhibits blood flow through an injured vessel and stoppage of blood, and has three major phases. We'll talk about the first big phase called the vascular spasm. This process begins when a damaged blood vessel constricts suddenly, restricting the amount of blood leakage from the vessel. This is referred to as the vascular spasm. It involves chemicals like tissue factor and ADP, adenosine diphosphate. The damaged blood vessels wall begin to release these chemicals to help stimulate further spasms. The second phase is called the platelet phase, also known as a platelet plug. Normally, the endothelial wall is smooth and coated with the compounds of prostacyclin. This will actually inhibit the ability for platelets to work. Once that blood vessel is damaged, the collagen fibers get exposed to the internal connective tissue, and the endothelial cells become exposed to platelets and begin to stick to the exposed collagen with the help of a protein called a von Willebrand factor. As the platelets begin to stick to the vessel wall, they develop these long processes that further adhere them to the vessel wall. As more and more platelets begin to aggregate, it forms what we call a platelet plug. This occurs just a few minutes after an injury. As platelets undergo these changes, their cytosol also begins to change by degranulating, and they release chemicals that assist in hemostasis. Chemicals like thromboxane A2, ADP, calcium ions, clotting factors begin to be released, and they start promoting the wound healing. Some chemicals that I want to highlight here that will prolong vascular spasm include serotonin and thromboxane A2. As more platelets are attracted with the release of ADP and thromboxane A2, it facilitates even more degranulation and the release of these chemicals. If the platelet numbers are very low in the case of a thrombocytopenia, then the platelet plug formation and coagulation may be severely affected. The formation of platelet plug is an example of that positive feedback and will continue until the plug is completely formed. Then eventually we lead to the third phase called the coagulation phase. This is the blood coagulation or blood clot formation. This involves the protein fibrin and fibrinogen. Fibrinogen is an activated form that forms fibrin, which is an insoluble protein. The blood coagulation requires many substances that start off with calcium, clotting factors, platelets, and vitamin K. We'll go over some of these key clotting factors and how they interact. Most clotting factors are inactivated enzymes and are mostly produced by the liver. Vitamin K is a fat-soluble vitamin that is needed to make certain factors. Factors like 2, 7, 9, and 10. These four factors require vitamin K for production. Then the final phase would be clot retraction, where the platelets contract and make the clot more compact, and eventually the pull of the wound edges together and it drops off and the scab regresses out. Let's take a look at the pathways leading to the activation of those clotting factors. So initiation of that coagulation cascade is very important. There's two separate mechanisms. We have the first called the intrinsic, which is called the contact activation on the left-hand side. And then we also have the extrinsic pathway, which is going to be a tissue factor activation pathway. Let's go over the intrinsic pathway first. It begins within 3 to 6 minutes of damage and injury to the blood vessel. The platelets begin adhering to the damaged vessel wall, and they release factor number 12. 12 is the first one being released. Factor 12 converts the inactivated factor number 11 to the activated factor 11. The letter A represents the activated version, and the factor 11 is going to activate factor 9 to the activated version of factor 9. Factor number 9 will then activate calcium, and also platelet factor number 3 to form a complex that converts the inactivated factor number 8 to the activated factor number 8. Once factor 8 is activated, then the inactivated 10 gets activated to the activated version of factor number 10. Notice that factor number 10 is the intersection between both the intrinsic and the extrinsic pathway. The extrinsic pathway on the right side is initiated within about 10 to 15 seconds. It's a lot faster. Tissue factor number 3, also known as thromboplastin, is released from the damaged tissues and combines with factor number 7. Tissue factor and factor number 7, 3 and 7 get combined together, and they form a complex. And this complex can then directly convert the inactivated 10 to the activated 10. So as you can see, this complex is a lot more efficient and quicker acting than the intrinsic pathway. Now after that happens, we then lead into the common pathway. Common pathway begins when factor number 10 from both either the intrinsic or extrinsic pathway is activated. So the active factor 10 combines with factors number 2 and 5 and calcium and platelet factor PF3 to form prothrombin. Together with activated 10, we'll then activate prothrombin into thrombin. Once thrombin is activated, it can convert inactivated fibrinogen to the activated form called fibrin. The fibrinogen will be activated into fibrin, which will be these cross links and stabilize those monomers, serve as a frame for the clot. Notice that factor number 8 can also directly activate factor number 12. And once 12 is activated, this will stabilize creation of a stable clot. Just remember, prothrombin is going to require prothrombin activator and calcium to become thrombin, and fibrinogen requires thrombin with calcium to make fibrin. So calcium is very important in this whole pathway. Let's take a look at the list of all the clotting factors. Notice that clotting factors are named after the Roman numeral. I also have the name. Factor 1 is also known as fibrinogen, which activates fibrin. It's found in both pathways. Clotting factor number 2 is called prothrombin, which is going to be a protease that activates thrombin, also found in both pathways. Clotting factor number 3 is also known as tissue factor, called thromboplastin. This main function is to activate factor number 7, and it's found only in the extrinsic pathway. Factor number 4 is calcium. It's essential in all the pathways, and it's also found in both. Factor number 5 is called proaccelerin. This is a cofactor that activates factor number 7, and also combines with factor number 10 to form prothrombin activator. And this is also found in both pathways. Factor number 6 is also known as accelerin, which is going to help activate factor number 5, and found in both pathways. Factor number 7 is called proconvertin. This is a protease that helps activate factor number 10, found only in the extrinsic pathway. And then factor number 8 is also known as anti-hemophilic factor, which is a cofactor that helps activate factor number 10, found in the intrinsic pathway. Factor number 9, also known as Christmas factor, is a cofactor that activates factor number 8, also found in the intrinsic pathway. Factor 10, also known as thrombokinase, protease which is used to activate the prothrombin activator, found in both pathways. Factor number 11 is the anti-hemophiliac factor, which helps activate factor number 9 in the intrinsic pathway. Factor number 12, also known as Hageman factor, activates factor number 11 and plasmin, as well as pre-kallikrein to kallikrein. This is for the dissolution of the clot, and then the intrinsic pathway. And factor number 13 helps stabilize the fibrin, forming the crosslinks, and is found also in both pathways. So other factors that prevent clotting and the elimination of the clot. Plasmin destroys the fibrin network through a process called fibrinolysis. It happens within 2 days of the injury and continues for several days. There are several causes for increased bleeding and decreased coagulability of the blood. The first pathway is called the anticoagulant pathway, in which the liver secretes antithrombin, a weak amount of that. Heparin found inside the blood also helps reduce the blood clots, and also heparin sulfate from the basophils. These are all considered anticoagulants. Protein C can be inactivated and then turned on with the help of certain thrombin and thrombomodulin compounds, and that will then also help inhibit these different factors, factor number 5 and factor number 8. Because you're inhibiting certain factors and also reducing clots, all these compounds on the left-hand side favor anticoagulation. So antithrombin, heparin, heparin sulfate, protein C. On the right-hand side, we have the fibrinolytic pathway. This is the breakdown of the clot. So once the activated 11 is available and activated 12 is available, the kallikrein and urokinase is going to activate the plasminogen, which is inactivated form, to the activated plasmin form. Plasmin form will then help break down the fibrin, this mesh network, into the fibrin-degraded products that will float into the plasma. Certain kinds of exogenous plasmin inhibitors can also help break down the fibrin, reducing clot. So just remember, factor number 11, 12, kallikrein, and urokinase are all important for activation of plasmin to break down the clot.